Hello everyone, my name is Dr. Mahesh. I am a practicing endocrinologist working at Health Roads Clinics in Vijayanagar. Borderline diabetes is one of the most common precursors before diabetes, and we see that patients with borderline diabetes go towards diabetes because they are not aware of the preventive methods. So we see that if you don't control your diet and exercise when you are having borderline diabetes, or also what is known as pre-diabetes, the risk of developing diabetes is almost 100% in the next 5 to 10 years. So if you don't do anything in next 5 to 10 years, you will definitely develop diabetes. So if you take good measures like diet and exercise, your borderline diabetes can become normal and at least maintain in that level for at least 10 to 20 years sometimes. Only 10% progress even if they have good control of diet and exercise. So 90% we can prevent the progression of borderline diabetes to diabetes. What are the food substances that you need to eat, and you should know what to avoid? What is that we should avoid is eating too much of white rice, eating too much of potato, avoiding any sugar sweetened beverages, especially sugar containing food, all the fruit juices which contain high sugars. We need to avoid them. We need to ensure that we are away from red meat. We need to also be aware that we should not take too much of junk foods. If you avoid these four, then your chances of progression to diabetes will reduce. Second is, what should you consume? You should consume whole grains, especially the brown rice, whole wheat, millets like ragi, jowar and foxtail millets, what we call as namane sajje. All these millets definitely contain fiber rich food. And you also look at all the articles and you look at internet, you will find substances that are rich in fiber. We need to consume foods that are rich in fiber. Take whole fruits instead of taking juices. You can consume 3 portions of fruits every day. You can use peanut butter. You can drink coffee and tea without sugar. And you can also ensure that you take Mediterranean diet, which is rich in vegetables and also foods that contain protein. So if you take these substances which are good for health, which are wholesome and balanced, you can definitely prevent diabetes. You should also ensure that you have a good breakfast and a very less dinner. The more you eat in the night, the more the risk of developing diabetes. So always try to take a good early breakfast before 8 o'clock, and your dinner should be just half or less than half of your breakfast. So this type of patterned eating, avoiding certain foods like white rice, potato, juices and sugars, with consumption of whole grains, fruits, vegetables which are containing rich in fiber, you will definitely be able to prevent, if not postpone diabetes also.